Good afternoon, everyone. Welcome to one of the first episodes of our video hackathon series for Velocity Health, where we are showcasing some of the really brilliant work that our internal talent has done around spotting some of the biggest challenges in the health industry and solving for them through the use of technology. So I'm going to immediately hand the torch over to our Vice President of Product Development, Santosh, who's going to introduce us to the team and tell us a little bit more about what this hackathon entailed and what the goal was. Santosh?
Yeah, thank you, Jennifer. Hello, everyone. This is Santosh Naladkar. I'm currently leading Velocity CV practice for MSD. As part of our yearly hackathon, this year we focused on HLS domain, healthcare and life science domain, where we want to leverage Velocity, also known as Salesforce Industry Cloud, and see how we can use out-of-the-box feature to meet some of the use cases for HLS domain. Okay, so in this use case, patient 360 interoperability, where we trying to showcase how Velocity out-of-the-box features can be leveraged to fetch the data, real-time data for the patient from the other providers' EHR systems, okay, which will help the providers to take care of patient in the critical needs. With that, our team who has worked very smartly and very hardly on this use case to make sure we're using a lot of out-of-the-box features to meet the requirement for integration with other EHR systems. So we are Tinu Ganeshan, Keshu Kumar Murugeshan, Jagdish, and Gobinath Srinivasan, who will go through the presentation as well as the go the use case. So Tinu, please take it forward.
Thank you, Santosh. All right, so as part of this hackathon, so we try to tackle a situation where interoperability makes more sense, right? So as you know, the patient's health records has progressed over the years from papers over to electronic health records. And when I mean by electronic health records, there are various different types of electronic health records in different formats, different structures. Some of them are HL7, some of them are FHIR revision 4, and even there are proprietary health records that are very specific to each providers. And these make it very incompatible when you want to access data from across different service providers. And those records even lose context when they get transferred over. And it becomes really hard for a patient when they go in an emergency situation in a completely different state that they live from. And they don't have all the background information for the service provider over there to actually look at their previous medical history. And then it becomes hard for them to even come up with a care plan to immediately address the patient's health needs. So the solution is to have a more standard approach on the electronic health records, especially when you stick to the standards that are more industry-wide acknowledged, especially HL7 FHIR. But the challenge with this is that the structure around this is too complicated, and most of the service providers hasn't transitioned over to these standards. And that's the major setback with service providers or the clinical, the medical providers and those, right? So it's because the structure is complex and it becomes really hard for them to even invest time and money in getting a system that is more standards oriented, right? So if you don't have these standards in place, you cannot even exchange data between your health information exchanges, and that's where the real challenge comes in, where you cannot access data across different states or providers. So what we did is using Velocity, we actually standardize some of these approaches to actually fetch these health information records, especially using FHIR APIs. And we did that without using a middleware, and we did that without without writing any line of code, which is basically out of the box Velocity, Omni Studio, data raptors. What it does is it actually involves various FHIR endpoints, FHIR data endpoints for, especially you have various endpoints for allergy intolerance or immunizations or diagnostics data. And these are very different data structures that goes around it, right? So we actually invoke those through Velocity Omni Studio using Data Raptor. It performs what you call as an ETL, an extract, transformation, and load of the data. It maps those data points with what's on your Salesforce Health Cloud. And also it transforms it the way it requires for your UI or your flex cards that you're using. And then it just loads it, and then your UI gets rendered. So it's all done without writing a line of code. Let me transition over to Jagdish. He'll show you a quick demo of this, and we'll look at the technology that we use after that.
Thanks, Tim. Let me share my screen. Here you could see the patient detail page that we have is nothing but the account. And in this patient detail page, you could have a 360-degree view of the patient's entire health historical data. And each of these UI that you see here are different flex cards, right? And these are basically, we are basically leveraging the Velocity flex cards here. And each information that we got from the different electronic health exchange records, which is belong to particularly this patient. Okay, we have this allergy information, EHR pulled, and the recent immunization details got pulled for this patient, and what are all the recent medication that is undergoing. Okay, and these all are part of the FHIR data that we are pulling particularly for this patient, okay? So that when the doctor or nurse or care provider look into this patient detail page, right, he is already aware that he is having this certain medical conditions, so that they can do their care plan accordingly. And here you could see all the recent lab results. This is one of the another widget that we are leveraging the same Velocity flex cards. And all these flex cards are powered by a data raptor behind the screen, which is pulling all the FHIR data, particularly for this patient. Okay, and here you could see there is a sync button there, right? Until we clicking the sync, the entire flex card data related to his current health condition that we are pulling from the EHR or from different health information exchanges. They are real time, not yet stored in their hospital's patient database. Okay, at the moment when we click it, these real time data are getting stored under our Salesforce Health Cloud environment, so that we are keeping the health history of this particular patient. Either we can share it to another care provider, or we can use when the same patient gets admitted in the same hospital. Okay, let me show you that how it is used in the Salesforce environment. What we are using is we are using the Salesforce Health Cloud to map all his electronic health conditions to different set of objects that is provided by the Salesforce Health Cloud. For example, you could see the EHR conditions, which you seen from this flex card, right? These are the existing conditions. Currently have a certain medical condition related to heart disease and a kidney related diseases. Each data were pulled from different health exchange platform and get stored under this health cloud environments, different clinical data model. And similarly, we have all the subset of models that which are matching with this particular electronic health information standards, right? So that it is very flexible for us to keep the historical data of the patient so that we will be getting the 360-degree view of the patient current medical health condition. Yeah, let me stop here and let me switch over to Gopinath for additional benefits and advantages.
Here we are going to see about the benefits which our patient 360 interoperability gives. So the main advantages here is like both doctors as well as nurse. So they both would be getting benefits using the help of model, so that it won't give them the diagnostic cost and saves their emergency time as well. Also, like additionally, it increases overall organization's reliability since it's an interoperability and gives trustworthiness. With the help of using Salesforce Health Cloud, with the integration of Velocity Health on top of it, and we are very yes. I'm starting with the point number 3. It increases overall organization's reliability and trustworthiness. Also, like it's a very fast you rated into it, and we are very glad that it's our MST's accelerator package, which gives for an accelerator integration with the middleware FHIR APIs. And finally, like customer satisfaction, and it's our only target, and we achieve that with the help of this interoperability. And with the help of this, we could have given an estimation, and based on this estimation, like whenever as Jagdish showing the demo with that, like creating of flex cards using LWC and Apex, it consumes our 40 estimated time is 40 hours. But when we are using Omni Studio for immunization, medication, and diagnosis and conditions, all the flex cards took only minimum time. And then like for importing FHIR data from FHIR, and it consumes like only 8 hours real actual time. So totally we designed this within the actual time of 22 hours, and it saved our 91% of development time. And it's one of the great achievement with the help of this Omni Studio Velocity. Yeah, thank you.
That's actually really brilliant. I only have a couple of questions that came to me. The first one, I know, Dina, you talked a little bit about this already in the middle, but well, I want to kind of pull it out and put a spotlight on it. And it's that normally for the kind of functionality you created, some kind of middleware is needed to pull information across, reformat it if necessary, and then deliver it, plunk it down into a different application where it's needed. You seem to have done that without middleware, and I'm wondering if you can just give us an overview of how.
That is correct. So if you look at Velocity Omni Studio, it comes with what called data raptors, and each data raptor has different kinds of actions called data transform, data extract, and data load or data save, right? It basically translates that as a middleware. So you use that technology to actually call an endpoint, get the data, and fetch all those data points and map it to what's required on your application, and then use it as is on your UI, or just dump it in your database. So that's a flexibility that Omni Studio provides. And you don't really have to, so if there are small providers or small companies, if they don't have the budget for a real middleware like MuleSoft, they could use or go with this approach and get this implemented at a faster time.
Right, right, absolutely. So you're looking at a pretty significant faster time to value. I imagine that also plays well into an incremental rollout of technology, because it allows you to just get functionality very, very fast. From an administration perspective, does introducing Velocity Health, that data model into Salesforce Health Cloud, make it easier to maintain? And if so, how?
Absolutely. So all these are done without writing any code. And these are
Mhm.
basically declarative programming where you actually go in to the Omni Studio or the UI and start building your processes over there, right? You would start
Right.
building the mapping, you would start building the ETL process and all that. It's all basically done through declarative or through the UI. So there is no line of code. So it becomes easy to maintain and easy deployments without having to run all the unit tests or mess with the code and breaking anything. Yeah.
Right, absolutely. And my last question, anyone can chime in. I was thinking Santosh, but getting this kind of really great glimpse into the work that you did. Now, I know as part of the hackathon, you had to create a scenario and you chose an emergency situation where every minute counts in treating someone or saving their life. And so this kind of technology is amazing for bringing information fast when it's needed. But I can also see that it's easily adaptable to many other situations. And I'm wondering if the quickest of brainstorms is, it seems to me that what other places can we adapt something like this technology to? Medicare comes to mind, because they have accountable care organizations initiative that requires a team of doctors to coordinate together to give the best care to someone. This kind of technology could easily be adapted to that kind of a scenario.
Yes,
Mhm.
as I said earlier, right, our primary focus was on the healthcare and life science domain. So
Yeah.
before we started this hackathon, we talked to the industry experts as well as looked at what client needs, okay? And then we put down those use cases and see how we can benefit the client as well as their customers, nothing but the patients, to get the required help and required care. Okay? And we see this one of the challenge where when one patient goes from one provider to other provider, then that provider doesn't have the required data, and then they face the challenge, especially in case of emergency situations where the data is not available to the doctor. They can use this system to fetch the data and treat the customer, give the required care.
Yeah, absolutely. I think that's absolutely brilliant. And I want to thank you guys for coming in and just sharing. I think it's very clear to anyone seeing the video how passionate we are about trying to use our expertise in system integration and what we've been doing since 2012 to help the healthcare industry reach its own goals. You know, we're developers and administrators, programmers, architects, but we're patients too sometimes. So this kind of technology touches all of us. And I really appreciate you coming on here today to share this glimpse into what we're doing and how vital it is. So thanks very much. For the folks watching, we will have some additional resources below the video for you if you want more details. And if you have any questions at all, there'll be a contact box or a comment section below. You can go ahead and input your question and we will reach out to you with an answer. So thanks for now, and we'll see you next time.